wanted to do a video on ACDF, which is anterior cervical discectomy and fusion, for those who are going to have to go through this. I'm hurting pretty bad, so bear with me. I've been suffering for several years, at least since 2022, with just trapezius, stiffening, tightness, muscle spasms, and then with my muscles going down the center of my back on the right and left side. And I've been getting trigger point injections for at least from 2022 until now, intermittently. Sometimes they would last 6 months. Sometimes I'd have to go back within 3 months and get them done again. So an update is that this last week on Thursday, I done some mopping, cleaning cabinets with, oiling down my cabinets. Everything was fine. Had no problems, no back issues, no problems at all that day, actually. And then Friday, I woke up in excruciating pain. I was having on my left trapezius muscle, this muscle here, but on my left side, it was spasming. And then my muscles on my back behind my scapula, under my scapula, was also spasming. And then the spasms went down my left arm into my forearm, and then my fingers started to become numb. And initially it was the last 3 fingers of my hand, and now it's progressed from my whole entire wrist, and I could feel it in my 2 fingers, first and thumb, numbness and tingling there. So it's become weaker on my left side noticeably. And then I'm getting pain that's shooting down from my elbow on the lateral aspect of my arm all the way to my wrist. And then I also sometimes I get the sensation of cold, really ice cold sensation on this part of my arm. And nothing that I do helps it. Like, you can cover it with heat and it's still there. It's so cold that it burns. And then my spasms were becoming constant in all of these areas. I took some cyclobenzaprine, which is Flexeril muscle relaxer, and I had been on those in the past, so I had some here at home, and I just thought, okay, well, I'll treat with that. Maybe this will go away, but it did not. So on the second day, the spasms were so bad and the pain was so intense in my shoulder, in my elbow, and shooting down my hand with the numbness and tingling in my hands. I knew I had to go to the hospital and get imaging and see what was going on. So once I reached there in the afternoon time, I had already been taking some ibuprofen and cyclobenzaprine for those 2 days. They started an IV. They gave me 4 milligrams of morphine. They gave me another 2 milligrams of morphine. They gave me some Zofran to prevent me from getting nauseated. They also gave me Ativan, thinking that would reduce the spasms that you could visibly see in my arms. My fingers would actually twitch because of the like tetanus, like a rapid tetanus in all along my arm, all the way down. And they gave me Valium also, and I was 100% fully lucid and still feeling the discomfort. So I already knew we would have to get, I wanted an MRI. The NP and the ED decided to just do CT, so that's what we did. And you could see that my trapezius muscle was so spasmed, in a spasm state, that it was making my cervical spine, which is in the upper neck, it was straightening it completely out. There was no curvature to my neck at all because of the spasms that was there. So she could not stop that. So they sent me home with muscle relaxers and pain medication and referred me over to see a neurosurgeon and an orthopedic surgeon. And I looked around in my particular area. I didn't want to just go by what they had suggested. I wanted to get report cards on who I was looking at because I'm extremely hesitant about anybody's touching my spine. They better know what they're doing because the risks that are involved, one false slip of the knife blade, you're paralyzed, you're damaged for life. And Christopher Reed had the C3, C4. That's where your C2, C3, against C3 to C4 injury can cause you to have to be on a ventilator, dependent for the rest of your life, and paralyzed. So I wanted to be very careful with who I chose. I lived in the Houston area and put my tentacles out to my physician friends in the area and was referred over to Dr. Cochran, who also found online, and his reviews were good. Does a lot of neurosurgery, especially cerebral, like CVA, people who's had bleeding in the head or cerebral aneurysms, that sort of thing. People that need craniotomies, their head cut open, evacuations, coils, fixing aneurysms, he specializes in that. And he's done thousands of these procedures that I'm going to need, which is, again, it's called an anterior cervical discectomy and fusion. So nobody was open on Monday because we had a storm. So all the offices were closed, and I couldn't get in to see anybody except my pain doctor, who had been giving me the trigger point injection since 2022. He was absolutely fantastic. His name is George Atala, and he's also here in the Houston area. So I went to him to see if maybe he could at least give me trigger point injections in my trap, and then down my infraspinous, down where my shoulder blades are, on my left-hand side, and see if the spasms could at least stop, because they were super intense. You don't get very much sleep with this. I can't even explain. It's very excruciating. I would have rather had birthed 3 more children than to continue to experience this pain that I was having. And even now, my fingers and hands is so numb that I have to put my hand above my head and rest here. And the only comfort that I get is by tilting my head down and to the side, because when I put my head back or in upright position or tilt backwards, that's when the nerve gets more pinched. My spinal cord is becoming pinched from the herniation that I have. I've been a nurse for 25 plus years before I became a nurse practitioner. And so I've done a lot of heavy lifting, pulling, pushing, getting people out of bed. And this is all the result of that work that I've done from being a nurse. So I get temporary relief when I do this, and you would think that it would hurt more, but it actually helps. I don't know, it makes me feel like my blood supply is a little bit better. My fingers and hands are a little bit less numb. Hand is a little bit less numb when I do that. But when I put it back down, then the pain is going to come back, and it's going to be shooting pain, especially through my elbow and the side of my arm. And this muscles they feel like a brick. They are so spasmed, and they just won't release no matter what I've taken to taking every kind of muscle relaxer that you can, pregabalin, Lyrica, methocarbamol, all of that. I've taken all of it, and nothing seems to help. Even the little Tylenol 4, which I don't like taking narcotics, but they gave me that, and the pain is still here no matter what. So I know it's got to be taken care of. So today I went to schedule an appointment. Thank God I got in to see Dr. Cochran. He is a neurosurgeon, and he works at multiple hospitals here in the Houston area, but one of the hospitals is a sister hospital to the hospital that I work at. I work at Memorial Hermann in Sugar Land, and he works and does his surgeries also about 20 miles away at Memorial Hermann Southwest. So his office is there on campus, and I went over to see him today. He looked at my views of my CT, but I also went ahead and got an MRI yesterday. They was able to fit me in at my hospital to get an MRI, and I was able to bring the disc and the images and the impressions over to him, and he was able to pull them up, and surely he sees that from my level I have multiple levels that he's going to have to deal with, from C5 all the way to C7. I have issues, and C4 to C7 is where I have my issues. So this is going to be 3 discs that he has to remove, and the term anterior cervical discectomy and fusion is because he's coming in from an anterior approach, which means from the front. He's going to be going on the left side of my neck. And what he will do is he will give me, I will be put under general anesthesia. They will intubate me, which means they put a breathing tube through my mouth into my trachea, and then that will breathe for me while they have me asleep during my surgery. And he will come through an anterior approach, and this is my cervical spine, is the vertebrae that runs from the head down to just about shoulder level, actually, close to that, just right above it. And he will come in from this cervical region, and he will make an incision that is about 2 inches in length. He will open that area up, and then he will have to move all of the structures, my trachea, which is going to have the tube in. He's going to have to move blood vessels, all of this anatomy, including my esophagus, which is your swallowing pipe from your mouth down to your stomach. That's your esophagus. So he has to move and shift all of that over. And then where you're intubated in your trachea, you also have your larynx, which is your voice box. So that's there as well. So all of this has to be shifted over and held during the surgical procedure. And he's going to remove 3 of my discs, and that's going to take about an hour and 45 minutes to an hour and 20 minutes. I think each disc that's removed takes about 30 to 45 minutes, is my understanding. So he will remove between C4 and C5, and then C5 and C6, he will remove that disc, and then he will remove C6 and C7, the cushion part, the disc between those vertebrae, and he will clean all of that out. And I do have compression against my actual spinal cord, which is where all of your nerves are running through. So this cushion is pushing into that, and it's causing the pain that I'm having on this side and all the burning and spasms and sensation that I've been talking about. So once he gets all of that cleaned up and he can see that it's no longer compressing against my spinal cord, then he will place titanium plates. They can use cages, they can use cadaver bone, little small pieces of cadaver bone. They can sometimes use a disc that is, I'm not sure what the structure is made of, but they can just put the disc in there. For me, because mine is multi-level and I have very straight, not a curved spine like I'm supposed to, I'm not a candidate for just having a discectomy and disc replacement. So I have to actually have the discectomy and the fusion. So once they get my disc out, then they will be putting the titanium plates between the C4, C5, C5, C6, and C6, C7. So the three levels. And once they get the plates intact, then they will secure that with a metal piece that will go over the two vertebrae, and then the screws will be attached to hold the vertebrae together so that that titanium structure cannot move, and then the bones will begin to fuse together. Usually the plate or the cage that's placed in there, it has a hole, so your body will naturally fuse together like it's supposed to. Sometimes it doesn't happen. Sometimes fibrous tissue is able to connect and hold the structure together, and sometimes people don't have fusion and they have to go back in and do a posterior cervical revision, which means they have to go in the back and they actually have to place screws to hold this together because their bones didn't fuse. That's the whole goal, is for your bones to fuse together. Some people don't have symptoms when they don't fuse, so they don't have to worry about it. It just depends on what their symptoms are. But if they do have symptoms, then they have to go through additional, either hardware revision or the addition of the posterior fusion. So I'm scared. I'm really scared, but I've already been told that there's a 95% success rate with the surgery, so that makes me feel better. Swallowing, they say that you're going to have swallowing issues. Anytime that they are shifting these organs over your trachea, your esophagus, you're going to be sore because you already had a tube in that was breathing for you. Your larynx is there, which is your voice box, so you can have a raspy voice that lasts for a while. Could be months, could be permanent. We don't know. And then the difficulty swallowing. Most patients, that goes away within the first 2 weeks, but you have to eat soft foods, shakes, milkshakes, smoothies, soups, pudding, applesauce, that sort of thing, because the swallowing is difficult. The recovery time is usually about 2 to 6 weeks. And I think he actually told me that he could probably do mine within an hour and 15 minutes with the 3-disc removal and getting it fused together with the bolts and the plates and all of that is needed to be done. Um, they usually suggest that you stay overnight because the pain level that you have, sometimes you can't swallow the pain medication once you get home. So they like to watch and make sure the swelling in your neck does not affect your breathing or your swallowing so much that you can't get food down. Then you become dehydrated and also live in a lot of pain because you can't swallow the pills that has been prescribed for you. So you end up going back to the hospital. So I think I'm going to opt to stay in the hospital. I don't like that. I'd rather be home recovering, but it is what it is. I think I'll stay the night. So I have to go at 8 o'clock in the morning, check in, get blood work, and then wait until, noon. It's already after midnight, so I have not had anything else to eat or drink. You got to have no food at least 8 hours prior. I'm doing mine about 12 hours prior. But I'm hoping for the best, and I think I'm gonna bring me some nice comfortable pajamas. Gonna get my heating blanket and bring with me, and then maybe some ice packs are really good for swelling. You don't want to use heat. That does bring the blood supply to the area, and it creates more pain initially. You want to decrease the swelling, so you always start with ice. So I think I'll ice down my neck, and so I may bring in an ice pack or something like that. I have these that can go in the freezer or they can go in the microwave. It's real soft. Purchased this on Amazon, and it's got little beads in it that smells nice, so it's kind of relaxing. And then that's it. And just hope for the best. I don't know when I can go back to work. He said 2 to 6 weeks is a healing process, and depending on what your work is, you can go back. I'm pushing it to go back in 2 weeks. Actually, I don't physically have to lift things. I can't lift anything more than 5 to 10 pounds in those 6 weeks, and so I don't have to do that anyway at my workplace. I may be able to get away with going back early, but he asked me not to push that. And usually you're required to go to physical therapy so that they can strengthen your neck muscles and help you with movement, motion, all of that, maximize your therapy so that you get the best outcome after the surgery. Some physicians, he did not mention this, some physicians with a level 1, like if you're only having 1 disc or 2 disc, usually one use a soft collar for the first 12 weeks or 6 weeks, 2 to 6 weeks. And then anybody who's having like a level 3 like me, some physicians will require that you wear a hard cervical collar up to 12 weeks. That seems like a long time to me. So I'm hoping that I'll be able to come back and give more information about how I feel and how this went. I'm scared about scars. I'm vain. So if anybody has any tips on how to decrease keloids or promote the healing process, I'm getting married next June, so in a year, I don't want to be able to see a large incision on my neck. 2 inches is big. That's pretty much it. I do know that there is less than a 1% chance of infection if you're doing what you're supposed to be doing. You can have a tear in the dura, which means your cerebral spinal fluid that's in your spinal cord. Sometimes that can tear, and that can cause you to have an extra 1 to 3 days of recovery, and they have to monitor you close. You have to sleep upright for like 3 days. They have to watch that. There's less than 1 in 1,000% for hardware revision that needs to take place for whatever reasons. And I know that within 6 months to a year, the bones usually fuse like they're supposed to. So, motion, I did ask him about that, and he said with my 3 levels, I could be a little bit stiff, but I would only notice maybe a 5% change in my motion of my neck. So that's pretty good. And usually if you're doing 1 to 2 discs, you don't feel any difference or a loss of motion at all, is what I'm told. So that's my story, and hopefully I can come back and give more information after the surgery. And I'm sorry, I've been rubbing and moving. I'm just fidgety because I'm in so much pain. It's no matter what I've taken, I'm in a lot of pain. So I'm hoping for that tomorrow gives me some relief, and I just want to, I guess, get this over. So I hope everybody prays for me, and I'll try to update later on and show my incisions and all of that. Here's my neck and how it looks now. So I think it's going to go right in here, in this part. There's my muscle. So probably right in here. That's where the incision will probably be. So that's what my neck looks like before. I guess he can fit it, into that little, there's already a wrinkle there. So he said he'd try to fit it into that wrinkle. So we'll see. He said he's a good seamstress. I told him I want one straight line and as small as he can get. So I will show y'all his work. And if y'all have any questions, let me know. And wish me the best. Thanks.